My name is Brendon Barnes, and I'm delighted today to have with me Professor Caradee Wright from the South African Medical Research Council. Thank you, Caradee, and welcome to the CISA CEPD podcast. Caradee, can you tell us a little bit about yourself, how you ended up where you did, focusing on environmental health and climate change?
Yeah, thanks very much for inviting me to speak with you today. It's a great privilege to be able to speak to this audience. My original degrees at undergrad level included environmental science and environmental management. And I've always been really interested and passionate, I suppose, about all things environment. One of the very first projects I did when I was still at school was looking at dune regeneration along a beach in eThekwini. And when it came to my honours year, there were two options for a project that I could do for my honours project. The one was around the effluents coming out of a pipeline into the ocean, and it didn't really appeal to me. And my proposed supervisor was sitting outside a gym waiting for her son to finish training, and she felt the sun burning on her arm. And she thought, gee, isn't there something we could do to measure this intensity of the sun, given that we know that it links to skin cancer? And that is how I got into the world of understanding climatology and being interested in climate change. And so my initial work was in skin cancer prevention and measuring solar ultraviolet radiation, but very quickly realized that there was so much more to the challenges within that realm, moved more into the air pollution space, and landed now where I am, more in the holistic climate change, adaptation, intervention, as well as the impacts space.
Wow, that's fascinating. And then you did your PhD in New Zealand. Was it
I did.
the same topic?
Yeah, so I did my PhD at the University of Otago, and I was measuring sun exposure of New Zealand school children to understand the risk factors that could be prevented to reduce melanoma, particularly in the New Zealand population. And I only recently found out the other day, my supervisor corrected me. I always thought I had a PhD in public health, but actually it's in preventive and social medicine. So that was kind of funny. I've been telling everyone for, 20 years the wrong thing. But yeah, it was a great experience, and I got to see New Zealand from top to bottom. And I really felt like I made a difference through that project.
Yeah, fabulous. So we know much more now about how the physical environment influences health, physical health. But we also have a very strong understanding now more than ever about the impacts on mental health. Can you tell us a little bit about what you think are the major issues affecting mental health from an environment and climate perspective?
Yeah, sure. So the first one that comes to mind is probably more common in high-income countries, but that relates to eco-anxiety. So young people are very concerned, especially young people, about what's happening to the world and about their future. The likes of someone like Greta Thunberg comes to mind, where she's trying to really advocate for more to be done to eliminate essentially climate change from anthropogenic causes. In South Africa, we also have people who are very worried, young people too, very worried about what's happening to the climate and our environments, be it pollution or the impacts of heat on health. We have climate activists. I know of a young girl in Cape Town, for example. And so that the eco-anxiety is the one aspect. And then the need to advocate, I guess, is another. But we also have a growing evidence from an epidemiological perspective to understand the causation, or not really causation, you can't do that in epidemiology, the association between environmental risk factors and mental health outcomes. We're involved in a study, a multi-systemic study, looking at the factors that influence depression among young people who are not in employment, education, or training. And it came up that we want to ask a question about, what kind of toilet do you have in your home, or what toilet do you make use of? And the rest of my project team didn't understand why I would ask about toilets, but toilets are all about dignity. And if you have, unfortunately, have diarrhea, for example, going back and forth to a long drop toilet outside, that's a shared one between houses or community, is not dignified. So these are real examples. The other things are more things around resilience. So it's very difficult to be resilient to climate shocks. For example, those that come from extreme weather events, when your adaptive capacity and your ability to be resilient is low. So we are starting to see more and more studies that are finding associations between these types of environmental or climate threats and things like depression or anxiety. Suicide has also been associated with changes in weather. Like, I know there's a relationship between the wind in Cape Town and suicide incidents. So I think this is an area of research that we do need to give more attention to, and also for the practitioners to be more aware of the impacts.
Yeah. And I like what you're saying about sort of the intersections of sort of social problems, or what we used to call social problems, with environmental problems and problems of local and global environmental issues. So I think that's useful, and I think certainly your work draws that out quite strongly. Now, if we zone in on climate change and mental health specifically, from your work and from what others have done, what do we know? What don't we know? And what do you think the future holds for that avenue of research, climate change and mental health?
Yeah, so I've mentioned a couple of things that we do know, but I think there's a large gap in what we don't know. So we are working on a systematic review that's looking at, it's a scoping review, that's looking at the impacts of heat on both physical and mental health of young people. And it was very difficult to find literature, especially for young people, around heat health impacts. So some of those, the physical ones at least, your classic examples are children in vehicles who've been locked in a vehicle and unfortunately do not survive. But the more nuanced things, like how are children performing in schools during very hot weather? There's more evidence of cold than hot. And in a warming world, where, for example, in South Africa, we're expecting temperatures to increase between 4 and 6 degrees Celsius by 2100.
Incredible.
It's alarming. If we're already seeing temperatures of 36, 38, that's going to push us over to the 40-degree mark. And we're seeing these sorts of temperatures all around the world, in America above 50, in India above 50. It's all, it's definitely changing. And when it comes to heat specifically, we haven't done enough across the spectrum of the potential impacts, including those on mental health. So I'm very interested in things like absenteeism, productivity, how people are with pre-existing mental health conditions are going to cope. There's actually, I don't think, anything on any literature on that. And it's a very real concern, because this will have a knock-on effect onto our public health care system if we start to see more and more people struggling with mental health conditions. And we know already that the public system is heavily, heavily overburdened and stretched. So, I think many of us should be gathering together to think about putting together perhaps a sort of strategic plan of these gaps and how we could work together to solve some of these challenges.
Yeah, and we know that mental health issues are increasing anyway. So, this is certainly not. It's certainly going to magnify issues quite considerably. For psychologists or people interested in the helping professions, what suggestions do you have to get more involved in the climate change arena?
Yeah, so that's such an interesting question because the typical response that someone will say is, please recycle, which is, the generic response. And of course, we should all be recycling because it can make a huge difference
Mm,
to the earth. But there's a lot more that we can do. In any healthcare profession, including for psychologists, I definitely think thought needs to be given to the carbon footprint of your work and your workplace. So
mm,
there's an organization called Healthcare Without Harm, and they help hospitals or healthcare facilities or practices think holistically about the impact of their work and practice and even their patients'
mm,
activities on their carbon footprints. And so this move towards greening, and I don't just mean that by planting and having green roofs. It would be things like changing to renewable energy, thinking about where your supplies and consumables are coming from and how one could perhaps upgrade those to ones that are more sustainable. Yeah, so I think taking it on in that way is very practical. And
mm,
then I mentioned before this concern that we have, and it's been in high income countries, but it's moving into low and middle income countries now, is eco anxiety. And
mm,
the fact that we are going to see this more and more, I think that the profession should start to learn a little bit more about what this condition is. And I'm not a psychologist, so I wouldn't really know, but there must be things that we can learn from the past and from others on what to do to help and support people who do suffer
mm.
from this condition.
Yeah, thank you. Caradee, one of your passions seems to be around emerging scholarship and young
Yes.
scientists and so forth. What bits of advice would you give young scholars interested in this topic?
Yeah, so I've always been really engaged in helping emerging researchers as well as mentoring PhD students, not just supervising them, but mentorship as well.
Mm,
And I think if you are wanting to get involved in the climate change and potentially health or even obviously mental health, if you do feel strongly about this space, then you should pursue it. You should, don't give up because it
mm,
can be a bit difficult for several reasons. It's not around funding. There's lots of funding in this space at the moment if you're wanting to do research. It's more that the field is becoming quite swamped and the competition is getting tougher. So, yeah, I think the first thing is don't give up if you really do want to pursue this as a goal. The other is to ignore the denialists. There will always be climate change denialists.
yeah.
And if I had to worry what they're thinking about, I wouldn't do half of what I do. So don't even consider them.
Mm,
And then the last bit is we no longer have, if you want to call it a luxury, of just doing research for research's sake. We have a responsibility now to engage from the conceptualization of a research project with a community or an NGO or a council or group of people who are very much embedded in the issue that you're wanting to work on,
mm,
and you have them as a partner in the project, and this helps to ensure that you translate the research into something meaningful.
mm, mm,
Guidance, policy brief, uh,
mm,
anything that can actually move things forward rather than
mm.
just an academic article. And I believe that is a new responsibility, and it comes with new challenges because we weren't trained in that way. So we've got to partner with science communication specialists, but really take on this responsibility of stakeholder and community engagement.
Yeah, no, I love all three of those bits of advice, Cordy. And I think that the burden of the climate emergency weighs heavily, particularly on people who are doing research, who are doing advocacy work, doing activism work. But we also, I like what you say. We also can't just sit back anymore and not have an impact. So, thank you for that. So, what's next for you
Yeah, that's a really good question. So, my plans for the next 5 years are to embrace big international projects in the climate change adaptation and health space, particularly on the African continent. So,
Mm,
I'm involved in two large projects. One is in Nigeria, and the other is in Ghana. And really want to trial interventions and find practical solutions, whether they're technological or behavioral, to change people's lives, to really improve this adaptive capacity against the shocks of climate change.
mm, mm, mm. Thank you, and we wish you everything of the best with those projects.
Thank you.
Caradee, thank you so much for your time. It's always a pleasure engaging with you, and thanks so much.